A very good day. This class we are going to discuss the differences between NSAIDs versus opioids. NSAIDs, that is non-steroidal anti-inflammatory drugs, includes examples such as aspirin, acetaminophen, brufen, diclofenac sodium, and etc. Whereas opioids include drugs like morphine, methadone, bethadine, fentanyl, sufentanil, and various other drugs. The first difference you should understand is NSAIDs are weaker analgesic, and they are mainly used for mild to moderate pain, whereas opioids, they are very strong analgesic and they can be used for moderate to severe pain, which includes fracture pain, pain from in the joint reduction or joint dislocation, and accidents, terminal cancer. Non-steroidal anti-inflammatory drug, the site of action is its peripheral, that it acts on the nerves in the periphery, and it acts basically by inhibiting cyclooxygenase enzyme, and cyclooxygenase enzyme inhibition will further lead to decrease in prostaglandins, which mediates pain. Whereas in the opioids, they act on opioid receptors, for example mu receptor, kappa receptor. So they act on these receptor at the level of spinal cord and as well as in the brain. The pain, abolishment of pain at the spinal level is called as spinal analgesia, and when abolishment of pain from the brain areas, which even includes emotional component associated with the pain, is called as supraspinal analgesia. And one thing you should remember that NSAIDs, they never depress CNS, so they have no interaction on the CNS as such. Whereas opioids, they also have action on the CNS and they have mainly depressing action, which includes sedation, euphoria, suppression of cough, and whereas it has some stimulatory actions like induction of nausea vomiting by stimulating vomiting center. One big advantage of NSAIDs is it does not have any abuse liability nor dependence, whereas opioids, the major drawback is it has a high abuse potential and it can cause both physical as well as mental dependence. And that's why opioids, it's a controlled substance. Okay, thank you for listening. We'll continue with some other topics in NSAIDs and opioids. Thank you very much.